am Dr. Joia Crear-Perry. I am an OBGYN by training, and I'm the founder and president of the National Birth Equity Collaborative. So our organization is now 10 years old, yay! And we were founded to focus on Black infant health. But about a year into our founding, we expanded to also Black maternal health. So that includes things like ensuring that mamas and babies are not exposed to lead. One of my previous positions, I was the medical director for the city of New Orleans. So I know a lot about lead and how it impacts our lives, and a lot about environmental justice as a New Orleanian and a past refugee. As a Black woman who's an OBGYN, I was, when I had my second child, I was married. I was intending to be pregnant. I was working as a physician. I had only risk factor I had was being Black, according to the CDC. And so when he came, he only weighed 1 pound, and I was only 5.5 months pregnant. I really knew that I needed to use the information I had as a physician, as a scientist, to debunk this idea that there was something about the amount of melanin that I produced that made him come so early, but really the environment. So things like racism, classism, and gender oppression that really caused me to have my son so early at only 25 years old. And so that's really why I founded my organization, because of my own personal experience. And if you meet a lot of people, their personal experiences are what makes them do the work that they do. Luckily for me, because of my background as an OBGYN and also having been the medical director for the city of New Orleans, I came also with some expertise along with my personal story. Even though I trained in obstetrics and gynecology, I went to medical school at LSU. I did my residency at Tulane. When we talked about infant death, we focused a lot back then on safe sleep. You might have seen billboards about putting your baby on their back and getting a crib, but we knew that the number one cause of infant death was prematurity. And so as a person who had a premature birth, when I would go into meetings, when I'm running a city health department, and they're only focusing on infant death from SIDS or from co-sleeping, and not the number one reason, which is premature birth, it made me realize that there was not a desire to fix what was causing that number one cause. And that cause is the same causes that cause Black maternal death. So babies and mamas are dying for the same reasons. It's not because babies and mamas make bad choices, or obese, or smoke too much, or don't want to be in a crib, or don't go to prenatal care. Every data set we show that Black women, despite income, despite education, despite prenatal class. So if they go to prenatal care in their first trimester, they're still more likely to die in childbirth than a white woman who has not entered prenatal care in the first trimester. So the whole point of my organization is to reframe the conversation away from blaming and shaming the choices and behaviors and the genetics of Black people, to really looking at the causes, the structural causes, the political determinants of health, the social determinants of health, the root causes that cause us to have babies early. So Black women in the United States, despite income and education, are 3 to 4 times more likely to die within a year of childbirth. And in some places, like New York City, it's 8 to 12 times more likely. We know that white women who live in New York City, if they work for the UN, a lot of them go to Geneva when they're pregnant, because they know when they go there, they'll have a year off paid leave. Their partner will also have paid leave. They will have free childcare, free daycare. So we ignore all the other structures that we need to have a thrive inside of birth. And we just say, go have this baby and come back and let it work in capitalism and be back at work in 2 weeks. We'll see you then. And so that decision that we make to devalue both people of color and women really meets at the point of the fact that we have the worst birth outcomes in the industrialized world for both babies and mamas. So the founders of Reproductive, right? So the founder of Planned Parenthood, everybody knows she was a eugenicist. So in their minds, so it's like saying people who were enslavers for their contemporary times, they were at the time. So yes, it was the normal cultural belief that people of color needed to be enslaved. Just like when people created the reproductive rights movement, they put family planning clinics in Harlem, in Black and brown neighborhoods, because they wanted us to have fewer babies, because they didn't think that we could raise our children well, even though we were raising white folks' children, right? So like just being honest about those histories. So I am a reproductive health rights and justice advocate, because I believe we need all three. So for the last 10 years, and we really focused in the beginning, we created what's called a birth equity index. So we looked at the cities who had the most Black births in the country, and we did a research study and we interviewed Black women who had an infant death to see what their lived experience was. What were the things that were happening to them when they were having this infant death? And then we also tied that to the data to show that it wasn't just that they made bad choices, but it was things like pollution. So the higher the pollution rate in your city, the higher your infant mortality rate. So then we could go back to those cities, and we did go back to those cities like Cleveland, like Detroit, like Jackson, Mississippi, and like New York. And we said, hey, instead of only blaming and shaming moms about co-sleeping, can you talk to the industries who are putting pollutants in the air? Because that's what's causing babies to die from SIDS. I have a friend who's a very fancy pathologist, and he travels around the world, and he doesn't diagnose ever SIDS. We don't have adult unknown, we might not know exactly why an adult dies, but we don't call it a syndrome. We just say of undetermined cause. But we do know the causes are things like pollution. And so for babies who are living in an environment where there's a lot of carbon dioxide, where there's a lot of pollutants in the air, what our data showed is that they're more likely to die. So we do research. We also do training. So we work with hospitals, big ones like Kaiser System, and small ones like in rural Louisiana, to really work on undoing the belief of a hierarchy of human value based upon skin color, based upon gender, based upon geography. And that requires us to really unlearn many things that we were taught, people like me. So I think the reason that our organization can be successful is because we recognize that we all learn these crazy things. I mean, I learned that there were 3 biological races in medical school: Caucasoid, Mongoloid, and Negroid. And this is in the 1990s. Right. And so I believed that there was a biological reason for disease because I was taught that by my instructors. And I have to unlearn that. Even when I know it's wrong, it's still in the back of my head. So I really have to work to unlearn. So if I have to do that as a Black woman who really loves my Blackness, I'm sure that many people who don't value Black people really still believe that there is something different about our Blackness, and that's why we die. So we do research to give kind of a basis for our work. We did a research project on respectful maternity care that is now used with A1, with all these fancy, the American Academy of Family Physicians. We created a definition for birth equity that's used around the world. We also do the training with the hospitals, and we do advocacy. So local, working with local health departments, state health departments, Congress, the White House, and the previous administrations, and then also with the UN. In fact, I'm going to the UN in 2 weeks to talk again about this maternal health crisis. And then the last one is really what we call culture shift, because even if you change the policies and if you do the research, if the culture still believes that we are broken, then we will continue to see us being treated poorly. So it's a lot of me talking, and not just me, my staff members on podcasts, on TV, on radio, just to change how we talk about and think about and stop blaming and shaming Black women for birth outcomes. For my space, when we talk about maternal health, I don't want to miss that it is important that we get rid of the toxins in foods, that we get rid of toxins in the waters, that we count particulate matter. Like all of those things for me are the environmental justice movement. That is has historically been a lot more scientifically based upon not individual, that's not the right word, upon toxins and things that happen in our waters and our soils, which do kill us. Like that is a truth. But I think because of the racialized nature of all these movements, like in my space, the equivalent is reproductive rights. So a lot of times when I'm talking about abortion, I just want us to be clear, the reproductive justice is the movement that I come from, not the reproductive rights movement. So in the reproductive justice movement, we talk about the full range of things. So although we need access to abortion, we also need access to infertility treatments. We also need access to making sure that our babies we're not criminalized in childbirth, and our babies are not taken from us because we're not seen as good parents. So I do think that there is a racialization of the movements. At least that is my experience. And so and climate justice is attempting, from my experience, to make sure that we're inclusive of environment and climate. I don't know, I don't want to cause a rift because I'm new to this space. And what I'm trying to do is add that what we do in Repro has also been harmed by all of these conversations. Because when you go from eugenics to population control to population affairs, you are then blaming and shaming women and people of reproductive age to say that they're causing in climate or environment. You can blame us for there's too many people, so that means too much consumption, and so they're putting too much plastic in the water. There's too many people, so that all that narrative is still the undercurrent. And we've been working really hard to move that out of the culture so that we don't continue to, because what we do then is make research that doesn't make sense. If we continue to research why people having more babies make more environmental problems, we're missing the point. If we could get the companies to stop making more plastic, that would be the point. The neighborhoods that have the worst outcomes not only have pollution, but they have fewer grocery stores. And the neighborhoods who have better outcomes have a lot of grocery stores. They have like the one so if you're in DC, the wards that have the people who have the most pregnancies are wards 7 and 8. They have no maternity units and they have no grocery stores. And then the wards that have, all of those things, people are not even getting pregnant. So we're not even matching the resource to what the people's needs are. So just start with that truth. So I'm an optimist. So that might be to my detriment. I always believe in human beings and that although right now is a crazy toxic moment, and although right now we see harm being done to people around the world, including sending immigrants to El Salvador, which is just shameful that we as a country, truthfully, should be ashamed of our current leadership. That being said, I believe that the majority of Americans are ashamed of that and don't want to see us become a place that picks people up on the street because they wrote an op-ed, right? And so all of those, we have data from the first Trump administration where birth outcomes for Muslim moms got worse. They had higher rates of preterm birth with the Muslim ban. So when you start targeting groups of people, we're going to see higher rates of maternal and infant death during his administration, not just because of his actual policies, but the cultural shift. It was like an energy shift, a spiritual shift. We are all tied energetically, we're all tied spiritually. If you have a person blaming and shaming people of color, immigrants, people who speak different languages, people of different religions, they are going to have worse birth outcomes. But I'm an optimist that it is so bad right now that we have an opportunity to really come together, that the words I used to say where I could only get kind of Black and brown people to hear me and some poor white people to hear me. Now we have places like in Texas where Amanda Cox, who was a upper middle class white woman, was looking she was miscarrying, and she had to sue the state at loss and had to go to another state to complete her medical care and to have an abortion. Abortion is a medical term. It's not a word that means I'm killing my baby. We use it for all kinds. We couldn't even code to bill for some of the complications of miscarriage without using the word abortion. So the word has been taken away from us and been threatened. I mean, it's been used as a threat. So what I see is us being to work with states and people who are in states like Texas, where my daughter had her baby, which I've always done, truthfully. I'm from Louisiana, so this is what I've always done. It's just that for the rest of the United States, they're not used to having to do what we've always had to do in Louisiana. We've always had people who could not get their full range of care in Louisiana, and we'd have to figure out how to make sure they got the full range of care. We've always had people who had to go out of state, and we'd have to put our little coins together to make sure that they could get the care that they need. And so now that's across the country, and we're seeing that when cruelty becomes policy, you see a wide range of deaths. And so I have a colleague named Dr. Jonathan Metzl, who's a white man who's a psychiatrist, and he wrote a book called Dying of Whiteness. What you see is when you believe in a hierarchy of human value based upon skin color, if you're a Black person, you do things like not want to live in Black neighborhoods and not want to speak certain jargon and eat certain foods. But if you're white, you do things like vote against the Affordable Care Act or vote for policies that are harmful, that actually kill you and your family. So it's getting to a tipping point that is obvious to everyone. It's not everyone, because they'll never be up there, but it's obvious to the majority of people. So it is my hope that our ability to have organizing at this local, state, federal, and international level. I love when I'm on calls with people from Nigeria. We have a whole family planning conference coming up in Colombia in November. It allows the world for us to still talk about. We need access to contraception, we need access to abortion, we need access to maternity care. And it's tied to the climate meeting that'll be in Brazil a couple of weeks later. So really tying this idea that instead of blaming the uteruses and the reproductive habits of people of color in Nigeria and India for causing climate change, really looking at the environmental injustices and how that's what's causing climate change, not the reproductive decision making of for resource people. So first, just understanding that there is a tie between reproductive health and climate. And as a person who was a refugee, literally, I was labeled as a refugee during Hurricane Katrina, even though I was well-resourced and was a physician, and my husband has a PhD, but we were having to move around. You don't get access to your birth control pills. You don't get access to all the, so you create then a climate injustice causes also a reproductive injustice. So how we need to make sure that we recognize that during climate crises, be it tornadoes in southern states, the people who are receiving health care for their reproductive health, pregnancy, contraception, all that was disrupted, and that we're going to have worse outcomes for those people. And so how do we focus on and ensuring that we don't lose sight of reproductive health rights and justice during climate disasters? And then how do we also hold communities accountable? So if you're in a city where you see billboards around safe sleep, to say, okay, I see that, yes, we were worried about babies sleeping, not being on their back and in a crib, but have we looked at what toxins are in our air and in our soil? And if there's too much carbon dioxide coming from buses near where there is a school or a daycare. So just in holding accountable as community, just being aware as community members that blaming and shaming individuals without holding the richer, more powerful billionaires accountable for the decisions they're making that are killing us is going to continue to kill us. And it's starting to kill all of us, not just poor resource people. At a state level, there's a lot of ways you can hold accountable. We don't have Medicaid expansion still in 10 states. Pregnant people and babies are the most, that's usually there are states that's 40 or 50% of the insured, how they get their care. So when you don't expand access to that payment for medical coverage, they have no way to get care. So they're seen as no prenatal care or free care because they have no access to insurance. So really just expanding access to Medicaid. I am a person who believes not Medicare for all, that you get rid of all the insurers, but if you had it available, that people could buy into it, no matter who you are, that you would see no uninsured in this country, because Medicare is a very good payer. Everybody takes it. And if you could, as a person who at your job or not, could pay $50 a month or whatever, $0 to get access to Medicare, I do think that we would see a huge difference in our healthcare outcomes in this country. Advocating for what's called the Momnibus. Lauren Underwood, Congresswoman Lauren Underwood, and Alma Adams have been advocating. We've been trying to get this bill passed. Every year it's used as a political toy, and we're reintroducing it again. There are 13 bills, and one of them is Senator Markey's around climate and maternal health. So how do we really get that package passed? Calling your senators, calling your congressmen, because even in this current dysfunctional moment, we still have to function. We still have to do things like, we still have to fund CDC, we still have to fund NIH. So we cannot let them just tell us what we're not going to do, because we pay taxes. And if he was legally elected, because I don't believe he was, but since he's there, he's going to have to be held accountable. And here's we want CDC and NIH, and we need the Momnibus to be passed. And then lastly, at the UN level, I really know this. Every person in the United States should care about the UN. We have learned that depending just on the structures of this country, without having a global understanding of where we are, it's harmful, and that we become isolationists, that we lose our ability our standing in the world. And so as many people as possible really learn about the UN, do UN events. I'm very honored and privileged that I've been able to work with them for the last 10 years. And I think the more that we can, things and institutions that we're learning right now about our own government only have as much power as we believe them to have. The US government is like Superman. If you don't believe he can fly, you can't fly. If you don't believe that we're supposed to be holding people accountable for the harms they're doing, even if they're the president, then we won't. If you don't believe the UN can hold our country accountable, then it won't. So if we believe those things, then we would act upon those things and do those things. So that's what my hope is, that regular Americans will start caring about the UN too.